Hello and welcome. I'm Vanita Dahia, discussing a patient who has metabolic syndrome using the NutriStat Complete testing. So the NutriStat Complete test is in actual fact a rather comprehensive test that investigates all the analytes associated with cardiovascular health, with liver function, iron studies, looks at vitamins, minerals, heavy metals, and also the endocrine system, such as the thyroid, the sex hormones. We also identify the zinc-copper ratios and nutrient profiling in the sense of essential fatty acids, amino acids, and organic acids. Now, the profile is quite in-depth. The first page of the profile will also give you a compound, a nutritional compound that can be compounded by a compounding pharmacist to tailor a nutritional formulation based on your test results. So the results, as I said, are quite comprehensive and they're quite detailed. So let's have a look at our patient who has metabolic syndrome. This patient is 39-year-old. She's a female who has polycystic ovarian syndrome. She now has recently been diagnosed with elevated cholesterol levels. She has had high blood pressure, and her work involves quite a lot of stress. So she feels rather stressed and anxious, and particularly feels pretty flat cyclically. She does experience cyclical migraines. They're less frequent outside of the cycle. And she obviously has weight gain, and she complains a bit of bloating and a bit of gastritis as well. She has recently been diagnosed with pre-diabetes. Now, there are many available profiles. There are two that I'd like to discuss, and that's the basic and the comprehensive. The complete NutriStat profile actually covers more than 240 markers, and this is the profile that we've done for this patient, purely because she has a cardiovascular issue, and we'd like to know what's going on for her. So when we had a look at her results, we could see that her cholesterol was elevated. Her cholesterol not only was elevated, but so was LDL. Now, that's what is normally measured in a conventional laboratory test. But we then delved deeper and did the LDL subfractions and found that she has an elevation of apolipoprotein B. This is a gene marker that is associated with pro-atherogenic LDLs. She also has elevated LDL3 and 4. All your LDL subfractions are fractions of LDL, which generally is pro-atherogenic, but all of them are not. And this is why a doctor might prescribe a statin for somebody who might have a slightly elevated LDL, and it's not generally necessarily warranted in all cases, because we can identify the pro-atherogenic component in your LDL subfractions. LDL1 and 2 are less atherogenic compared to LDL 3, 4, 5, 6, and 7. Now, in this patient, we see that her LDL 3 and 4 are elevated. That clearly gives us an indication that she is quite pro-atherogenic. A statin could be warranted. Ideally, you'd probably want to get her onto a low cholesterol diet, perhaps use strategies or nutrient strategies that will help reduce the cholesterol, and that would incorporate clearing out the liver, how the liver clears out cholesterol, and using agents such as niacin, bergamot, and your red yeast rice, and those sorts of strategies. Her mean particle size is on the lower side of normal. That clearly tells us that these are chylomicrons. The smaller the chylomicron, the more atherogenic they are. Then we moved on to her UECs, and we could see that her sodium levels were elevated. Now, sodium, we know that is associated with high blood pressure, but also can be associated with dehydration, and that could impact the adrenals and the kidneys as well. Her anion gap is elevated. Now, this is quite an important marker of metabolic acidosis. We know that acids are corrosive in the body. They're associated with inflammation, and a metabolic patient definitely has inflammation. So we'd want to institute or consider a alkalizing diet, reduce the acids, tomatoes, oranges, pineapples, red wine, red meat, etc., but also stress. Stress is the biggest acidifier. Her globulins are low. That probably could indicate that, you know, her protein content might be impacted as well. Her vitamins, her B12 is good, but her folate is on the lower side, and vitamin D is quite low. So one would expect to possibly consider supplementing with vitamin D, because ideally we'd like to see it mid-range, because it's necessary for bone density, for depression, for all sorts of physiological functions in the body. So now we can see that her thyroid's, having a look at her endocrinology, we can see that her T4 is adequate. Her T3 is within normal range, but it's low relative to T4. This means that she's not converting or activating that T4 to T3. So the cofactors that are required to activate T4 to T3 conversion are tyrosine, iodine, selenium, zinc, etc. So one would want to consider supplementation of those cofactors to normalize that ratio. Now, she is a 39-year-old patient, so what we want to do is we want to actually have a look at her hormone levels. Now, as we can see, her progesterone is 0.2. Her luteal phase progesterone should be between 4 and 14, so hers is rather low, okay? And that probably, we know that its metabolite allopregnanolone is a GABA stimulator, GABA mimetic, so this is the reason why she may be anxious, because low progesterone means low GABA, which means anxiety. Her testosterone is elevated. DHEA is within normal range, but her testosterone is elevated. In light of a normal DHEA, I generally look at three sort of drivers that would drive testosterone up. One is estrogen dominance. Now we can see her estradiol is 53, and it should ideally be between 60 and 232. That means both her progesterone and estrogen are low, right? So she'd have trouble with periods, with fertility, with all of those sorts of issues. You'd want to optimize the two main hormones in a female, mainly progesterone and estrogen. Now, she does have PCOS, so we suspect that elevated testosterone not only is associated with hypothyroidism, and we can see that her thyroids are perfectly fine, we just need to optimize it. Estrogen dominance, we know that her estrogens are not dominant, both low, both progesterone and estrogen are low. And the other one is insulin resistance or sensitivity. So clearly she's pre-diabetic, HbA1c might be elevated. So clearly we can see that we really need to focus on her dysglycemia. And then moving on, we can actually see that her minerals and metals are rather out of whack, in that she has a low level of iodine and selenium. And this really tells us that her cofactors are required for T4 to T3 activation. Her manganese is low, and this is involved in GABA production, involved in bone remineralization. So, you know, she may be a candidate for osteopenia in the future. Her copper levels on the high side. So here we can see that generally copper is associated, and zinc obviously is low. So copper zinc ratio needs to be normalized. We need to supplement her with sufficient amount of zinc to rectify the copper. Magnesium is low, and we could typically see magnesium associated with energy production, with muscle function as well. So low magnesium, we need 20 molecules of magnesium to actually produce 1 molecule of ATP. So that's one of the reasons why magnesium is possibly deficient in most westernized societies. Now, the other thing that I think is worth making mention of is the fact that her chromium and vanadium on the low side of normal. That means that there's obviously some level of dysglycemia. So definitely we would want to rectify that. Her mercury is on the higher side. Obviously, she's upper limit is 2 and she's at 3.6. So clearly we need to consider some level of chelation to chelate that heavy metal out of the body. Now, having a look at a copper, we could see that a red cell copper was elevated and high, and her full blood serum copper was high normal, and therefore, and we know that a zinc was low. So now we need to think about, why is that copper zinc ratio high? There could be an association with a depletion of ceruloplasmin. Now, ceruloplasmin is in actual fact a plasma protein. It's a little taxi that carts copper around in the body. So when ceruloplasmin is low, there's not enough taxi around to cart the copper, and so the rest of the copper that is not bound then becomes oxidized, and that oxidized copper can be as damaging as a heavy metal toxicity. So high percentage free copper is usually associated with somebody who has mental health disturbances. That might be associated with headaches and migraines, and she does have cyclical migraines. Could be somebody who is a slow metabolizer, slow oxidizer, and this is somebody who probably does because she has weight gain. So we need to think about, how can we rectify or clear that excess free copper? Patients like this would often be burnt out, adrenally burnt out. So we need to think about strategies to drive down that copper and normalize the zinc copper ratios. One is we need good adrenals to keep the ceruloplasmin happy. So we need a good amount of antioxidants and vitamin C and good adrenal support to raise your ceruloplasmin. And secondly, to drive down that excess copper, we may need to consider strategies such as vitamin C, zinc, magnesium, manganese, molybdenum, and some of the amino acids such as threonine, histidine, and glutamine. Moving on, we see that her essential fatty acid profile is pretty good, actually. Her omega-3s are low relative to omega-6. Generally, the first panel is really where the meat in the sandwich is. The rest of the panel is really further detail about each of these omega oils. So we need a good ratio of omega-3, 6s, and 9s, and her omega-3 is low relative to omega-6. So this is then, therefore, that's the reason the ratio between omega-3 and 6 is low. So we need to think about strategies to raise those particular the essential fatty acids. So these are things like flaxseed oil, fish oils, hemp seed oil, nuts, seeds, etc. So definitely consider. So that then leads to, if we don't rectify it, it could contribute towards the pro-inflammatory pathways, your prostaglandin and leukotriene pathways, which then contributes towards, pain and inflammation. So now let's move on to the amino acids, and we can see that her amino acids are, they're pretty ordinary, aren't they? They're pretty low. So it's clear that her protein content is a bit of an issue. She may not have enough protein in her diet, or then we saw that her folate levels were on the lower side of normal. So there may be a methylation defect. There's another issue that we need to think about, and we can see that in her intermediary metabolites. So let's take it from the top down. We can see that arginine is on the lower side of normal, which indicates that, there's not enough oxygenation. It's a vasodilator, right? Nitric oxide stimulator. Her leucine, isoleucine, valine on the lower side of normal, which indicates that she doesn't have enough branched chain amino acids. That's probably the reason why she has a problem with muscle aches and pains. Methionine is on the lower side of normal or low, and that tells me that she has a problem with her SAMe pathway. So we may need to incorporate more protein sources, but not only find out not only the protein source, but also have the cofactors in place as well. And as we can see that aspartate is on the lower side, this low aspartate is usually associated with depression. It inhibits the ammonia detox pathway. So we may need to think about giving her some alpha-ketoglutarate and vitamin B6, etc. Cysteine is on the high side of normal, so that tells me that there's probably something going on in the transsulfuration pathways. We may need to consider stimulating that CBS pathway. Her GABA, on the other hand, is on the high side. That tells me that she's obviously got anxiety or she's hyper excitable. A glutamate or glutamine is on the low side. This tells me that she has, glutamine is a precursor to glutamate and GABA, and that tells me that she has a problem with not only GABA pathway, but also it acts as a major prebiotic in the gut. So she may have gut issues, and she said she had bloating. Proline and ornithine are needed for cartilaginous function, and we can see that proline is on the low side. So that tells me that she may have a problem with ligament tissue, cartilaginous tissue, collagen, etc. And that could lead to, in the future, some level of osteoarthritis. Now, the intermediary metabolites, all of them are pretty low, and that now tells me that she does not have the capacity to transaminate her amino acids. So she may be taking enough protein or not. So if she's taking enough protein, then what's going on? Why are those intermediary metabolites so low? She may be lacking the cofactors, such as B group vitamins, to help transaminate the amino acids, or she may be hypochlorhydric. In other words, we may need to consider some betaine hydrochloride for her. So that's more or less, and we can see her glycine and COE are nice, and it's sufficient over there, so that's good. So that's essentially the amino acids. Now we move on to her organic acids, and the organic acids really give us an indication of what's going on in terms of her energy production in the form of ATP. So we take on fats, carbs, and proteins to produce energy, and when the energy is not there, then there are obviously some level of metabolic blocks within the citric acid cycle or through the oxidative phosphorylation. So when we have examined her organic acid results, we can see that she has an elevation of ethyl-malonic acid and methylsuccinic acid. Tells me that she has a problem with fat maldigestion or fat utilization. So fats are actually digested with the help of lipases from the gallbladder and bile acids from the gallbladder to break them down into free fatty acids. And these free fatty acids need to be taken up by the mitochondria with the help of a taxi. That taxi is called carnitine and B2. So we may need to consider supplementation of those cofactors to improve her fatty acid metabolism. As far as the carbohydrates, they're all good. However, lactate is high relative to pyruvate. So number 6 and number 7. So if lactic acid is elevated relative to pyruvic acid, then I know that her carbs, her lovely pasta meal, is not converting into energy. It's actually, some of it is actually converting into lactic acidosis, and that causes muscle aches and pains. The citric acid cycle is relatively good. Fumarate's a little bit on the lower side, and we'll talk about that in a minute. Her B group vitamin status there is fine. Xanthurenic acid is fine. A xanthurenic number 21, by the way, is a very important surrogate marker for B6 deficiency. Now, we could see that her folic acid was fairly low up in her bloods, and now we can confirm that number 24 for aminoglutamic acid, the FIGLU is actually elevated. This tells me that she actually needs folic acid. So you may need to think about leafy green vegetables as well as a methylfolate supplementation. Now we can see that a HVA is on the lower side, homovanillic acid, and VMA is fine, as well as 5-hydroxyinolacetic acid is low. So HVA is a metabolite of dopamine. Remember we said fumaric acid was on the low side of normal? It is actually the precursor cofactors for fumaric acid are tyrosine and phenylalanine. These are the very cofactors that are required for dopamine production. So if you have low dopamine, you're likely to see somebody who's got no satisfaction, no motivation. It's a reward hormone. So this is somebody that'll be fairly flat. With her 5-hydroxyinolacetic acid being low, that could be associated with a low serotonin level as well. And this is why she's probably feeling a little bit flat and sad. The cortisol is really, really elevated. And this is where you might want to do a diurnal pattern of cortisol to understand which stage of adrenal dysfunction she is at, whether it's insufficiency, resistance, or exhaustion. So being that high, she's obviously wired and tired. Then we move on to her detox markers. Now, her detox markers are pretty good. They're not bad at all, but she has some level of bacterial dysbiosis. Benzoates are elevated. Para-hydroxybenzoate is elevated. Now, benzoates are typically found in our foods that have, our preserved foods, such as canned foods or frozen foods or dried fruits, or pickled foods. That's where we find a lot of sodium benzoate. And these benzoates are in actual fact directly associated with intestinal bacterial overgrowth. The benzoates are actually converted into high purates by conjugation with glycine, and obviously glycine is needed for glycination, conjugation, liver detoxification pathways. So therefore, you may want to consider optimizing the glycination liver detoxification, and consider probiotics as well to restore that diversity of the microbiota. Oxalates are nice and low, and then as we see, her nutritional markers, on the other hand, are B6 being low, B5, your vitamin C is low, so you may want to use that nutritional formula. Now, after 3 months, we firstly gave her some of the nutritional supports. So we gave her the nutritional compound, and in conjunction with that, we considered all of these options. She wanted to actually get on top of her physiology and optimize her health pretty quickly. So we gave her some vitamin D in her compound, essential fatty acids, initiated the bergamot and niacin. She was reluctant to take the prescriptions and decided to do the nutritional compound, and was going to consider the statins after discussion with her doctor to adjust the diet. So this is what she's done. She's done a bit of exercise. We really spoke to her about her diet. Is very important. Like a ketogenic diet would not be appropriate for her up front because she had a problem with fat metabolism. So once you rectify that and incorporate strategies to improve hypochlorhydria, a good Mediterranean diet with lots of vegetables and good protein and the cofactors, then she would come good. Okay, so as far as a UEC, we tried to alkalinize the system as much as we could and used progesterone and biased, which is your two estrogens, estradiol and estriol, in a bioidentical format to start to regulate. She was only 39, so there's no need for her to have that lower progesterone. So using BHRT short term and P&E. We couldn't give her licorice for her PCOS because she had high blood pressure. For excess copper, we considered the amino acids, zinc, manganese, molybdenum, vitamin C, and also considered chelation strategies. The fatty acid metabolism, we incorporated the bile acids, lipases, and carnitine. Carnitine was contained within her compound. And then we supported the serotonin and dopamine with some of the amino acids which were in her compound as well. And then we gave her some of the herbs that supported adrenal function. So these are withania, rhodiola, ginsengs, etc. Now, excess cortisol, we considered using some of the choline derivatives. Phosphatidylserine was used, but we also suggested that she use lecithin to help with, a handful of lecithin in a cereal would actually also incorporate, and some of your eggs, incorporate eggs in the diet to help with choline supplementation. And then, of course, with the bacterial dysbiosis, we gave her some probiotics. Now, 3 months afterwards, we actually had a look at her results, and we saw on the left is her original result. And just using nutritional supplementation, no pharmaceuticals were used at this point in this particular patient's case. And she had actually improved significantly. Yes, her LDL-3 and 4 was still elevated. And then we discussed the option of her using a statin to actually ensure that her cholesterol was in check. The next thing, her sodium levels were normalized. Just by alkalinizing the system, you can actually improve the entire mineral count, and you can actually improve the way the liver, the kidneys work. As far as the hormones were concerned, they started to come a little bit good, not good enough, but it actually improved significantly. As far as her chromium, cobalt, etc. The low cobalt is associated with B12 deficiency. So incorporating some of those methylating cofactors was able to restore her mineral count. Her mercury, surprisingly, after cleaning out the liver, after using those nutrients, her mercury was non-existent. So this tells me that, cleaning, it's not just using a chelating agent. It's taking the whole body and restoring all of the chemistry. The copper zinc ratio was actually normalized, still not good enough. The free copper was reduced from 36 to 28. So we still had some work to do on her copper zinc ratios, but that improved her mood. She said her mood was so much better. Just incorporating some of the omega-3s in her system, she was able to improve her omega-3/6 ratio. As far as the amino acids are concerned, most of them are still on the lower side, but improved significantly over the 3 months after we tailor-made her prescription for her based on her deficiencies. And as far as the organic acids are concerned, we see that her fatty acid metabolism had improved. Still work to be done. Her folate and her methylating cofactors were definitely improved. And then we saw that her neurotransmitters had also improved. So as far as the bacterial dysbiosis markers were concerned, we saw that it was less dysbiotic, and her vitamin count was definitely improved. So all in all, she had actually reported that she had more energy. She was feeling less bloated. She had started to lose a little bit of the weight. Her migraines had reduced significantly. She was feeling less anxious, and her lipids started to normalize, and her BP became a bit more stable. So this is the power of NutriStat Complete. It is important to note that you can use chemistries that can reveal so much about your physiology. So do consider the use of NutriStat Complete. And if you have any questions whatsoever, don't hesitate to give us a call at these contact details on the screen. Thank you.